Assalamualaikum everyone, welcome back to this channel. This is me Alia Waheed, and in this video we are going to discuss about the anti-emetic drugs. First of all, you have to revise that all the receptor which I have taught to you in the previous lecture, we have discussed what is the mechanism and by which pathway the vomiting can occur and what are the reasons of it. Then after that, what we are going to give the antagonist of all of these receptors in order to stop the vomiting, like H3, serotonin type 3 receptor agonist, histamine agonist is blocking the histamine receptor, muscarinic antagonist is blocking the muscarinic receptors which are present on your vesicular apparatus and as well as on your vomiting center. Then we have corticosteroids. These are also useful for stopping the vomiting, benzodiazepine and N1 antagonist, N1 K1 NK1 is the neurokinin receptors, and lastly we have dopamine antagonist. Okay, now let's discuss all of them. So first of all, serotonin antagonist is used after the kidney surgery and the anti-cancerous drug eaten. After you have taken a cytotoxic drug or anti-cancerous drug, you have to take this anti-vomiting, yeah, anti-emetic drug. There are some side effects of these drugs. For example, it has well tolerated side effects. Well tolerated mean that it has a very small and little kind of side effects like headache and downiness, that you can feel very fatigued and tired and you have some type of headache. On the next side, I have written the four drugs which are 5H3 antagonists. First drug is ondansetron, granisetron, palositron, and dolasetron. They all end with the word citron. So the word or the mnemonics to remember it is that you can remember by O, Don, Palo, Dola. Okay, so this is the mnemonics to remember it. O से O, ग्रानी से मतलब हरामी, डॉन से डोला, एंड पालो से मतलब है पालो, किसी को पालो, ठीक है। ये इसका निमोनिक्स था, इसको याद करने का। नेक्स्ट आप देख सकते हैं कि हिस्टामिन एंटागोनिस्ट है। हिस्टामिन एंटागोनिस्ट हम ज़्यादातर मॉर्निंग सिकनेस जिन लोगों को होती है उनको देते हैं, बट इसका साइड इफ़ेक्ट ये है कि इससे ज़्यादा सेडेटिव एक्शन के होते हैं, मतलब आपको इससे ज़्यादा नींद आती है। तो ये ड्रग हम पेशेंट को दिन के वक्त नहीं दे सकते हैं, वी कैन गिव इट एट द नाइट because it have some types of sedative type of side effects. So the drug for it are dimenhydrinate, cyclizine and meclizine. Okay, then the next drug is muscarinic antagonist. It has some side effect like the atropine. Atropine like side effect are like it caused the increase. So atropine like side effect are we have increase in the dryness of mouth, the heart rate increases and headache. These are some atropine like side effect. And the drug which is used as an anti-muscarinic drug is scopolamine. It is very specific drug for the motion sickness. So over the histamine antagonist, we prefer muscarinic antagonist most because histamine has side effect of sedative and muscarinic antagonists are more preferable. Then we use corticosteroids like glucocorticosteroids. These steroids have no importance in them, and there is no well-known mechanism that how they are stopping the vomiting or emesis. But it is supposed or it is suggest that the glucocorticosteroids is actually stopping the production of receptors. So if the receptors does not produce, so there will be no vomiting. So the drugs which are corticosteroids are dexamethasone and methylperidinosol. Okay, dexamethasone and methylperidinosol, and these drugs are actually given with the combination, like dexamethasone is given combination with the 5H3 antagonist. So in the combination they will show better and most effective way response. Next is benzodiazepine. You know very well that benzodiazepine are the drugs which have sedative action and they cause the drug dependency in the patient. So therefore, it has side effect of sedatives because they induce sleep in them. But we can use them in order to sleep the in order to stop the vomiting, like the drugs which are benzodiazepine are lorazepam and alprazolam. ठीक है, lorazepam and alprazolam. Then the next antagonist is NK1 antagonist, neurokinin receptor antagonist. So it has side effect like it can cause diarrhea, it can cause fatigue and cause abdominal pain. But the drug name which are NK1 antagonist, that they does not allow the substance P in order to bind with NK1 receptor on the CTZ area chemo trigger zone. So these drugs are apripitant. All of these drugs are end with the common word which is apripitant. Apripitant, rolapitant, and newtpritant. So these are all the drugs. Now the next antagonist is the dopamine antagonist. So dopamine antagonists are actually blocking the dopamine receptors which are present on your CTZ area. So there are three major division of dopamine antagonists. First is substituted benzamide. They have substituted benzamide like nature. Then the second have phenothiazine, and last is butyrophenone. So substituted benzamide has a drug of metchloroperamide, okay, and it has some side effect like extra pyramidal symptoms can occur. Extra pyramidal symptoms are just similar in the case when we have Parkinson disease. So uh, next is phenothiazine. The drug which is placed in the phenothiazine is the prochloroperazepam. Okay, pheno and prochloroperazine. Next is the butyrophenone, and the butyrophenone is again consists of two drugs in it, which is very easy to remember. Like it has haloperidol. Haloperidol mean we are if there is a peridol and we are hello to it. We are saying hello to him. So haloperidol. And the next name of the drug is dolpridol. ठीक है डोल यानी गुड़िया प्यारी पेरी और फिर डोल ठीक है so these are all about the drugs which are used as an anti-emetic drugs, and we have studied about their side effects and as well as their name, and we have studied that why they are important. So this was all about the lecture of anti-emetic drugs. So in the next chapter we will discuss about the anti-diarrheal drugs, and then we will discuss about the laxatives. So I hope that you will understand this lecture. If you have some type of confusion, then you definitely leave a comment and I will give answer to you. So if you like this video, please subscribe to this channel, like my videos, and also share it with your friends. Take care. Meet you soon in the next lecture. Allah Hafiz.